Good evening, you guys. This is me, Messy Jessie, on the thin line, and I am here with one of my favorite people, SOS.
SOS. And I'm sorry, but I am sick, so my voice is terrible tonight, but we're going to keep going through this. And I'm here with one of my favorite people, and this is David Tovar. He was actually our first
Hi,
guest,
everybody.
and he's back because we're going to share more stories and talk more about PTSD.
Yeah. Hey, I also wanted to say happy Shenanigans Day, everybody.
Yes.
I'm wearing my
Yes.
green clothing
I,
as we can tell. Happy St. Patrick's Day.
You
yep.
bet.
You get your corned beef and cabbage on and your green beer. Although I don't like green beer because it turns my tongue green. It's
It's a one
terrible.
day. It's
It's for
okay.
one day.
Yeah. So, are you wearing green, Jesse?
It is, but it's a dark green.
It's very dark, yeah. Okay, that's
Yeah,
cool.
dark like my
Green is
soul.
green. Everybody is Irish on St. Patrick's Day.
Everybody is. You are 24/7 now.
Oh, man. So, Dave, we're gonna share some more of your, stories. You were EMS, you were in the Navy, and you were a
Yep.
corrections officer.
Yes, ma'am.
And
The story that I have on the frontal lobe right now is I had just become a paramedic in Kern County. I believe I was late 18s, and I had a new EMT which would drive, and he was a bit older, a gentleman. He was a good 40 years old, compared to me, of course, being 18, which was a story within itself. I remember we would get on scene, and being the highest trained medical person on scene, I was the scene commander for the medical portion, and I'm 18 years old, and I remember pulling onto scene and having all the highway patrol and the fire department, and usually my EMTs were a lot older than I was, so they would all come up to my driver and, what do you want us to do? And it was just hilarious because they would, before they got to know me, it was like, I don't know, ask the kid. And yeah, but I remember we were coming back from a scene, and it was a dry run. They called us off, and we're coming back, and we had come up on an accident, um, it was called in, and the dispatch had asked if anyone was near. We were really close by, and so we ended up responding. Highway patrolmen were already there. They had called Lifeline, the helicopter, the Life Flight, and the Life Flight was in the same vicinity. I think it was only 30 miles away, so they got there fairly quickly. And I remember the new driver taking us through the highway, and there were it was early in the morning, and there was a lot of lights, and all the wee woo lights and everything going off. And he drove around the highway patrolman, um, which was yelling at him to stop. And I remember hearing the blades of the chopper just really accelerating, because my driver was driving underneath the helicopter as it was landing. It was early in the morning. It was a terrifying scene, and it was I could just hear the helicopter on top of the unit just doo 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 taking off again. Um, the driver got so scared that he pulled over, and yeah, the highway patrol was not very kind with his words to him, and neither was I. We were terrified that We almost took down the chopper, and the chopper almost cut us to bits. Um, thank God that the chopper ended up going back up a little bit, and was allowed to come back down when it was safe. Um, but as I was working on the client, it was a truck that went off an embankment and hit the side of a railroad, and the man was pinned inside. Um, Throughout that time, I'm trying to talk to my driver to get, or the EMT to get my equipment and get this, but he is so out of it. He is so stressed out. He had just been really reprimanded by law enforcement on scene, helicopters. I mean, they just laid into him. He almost killed a lot of people from his mistake. So he was unable to function, and I had to call for a second unit to come and pick me and the client up and take us on on a new ambulance, because my driver was no longer able to drive. He was, under tremendous amount of stress, and he just was not functioning anymore. Um, During that time, I remember laying on the hood because the man was pinned in the vehicle. The whole front end of the truck had got crushed in, and it used to get really foggy in Kern County. The two-leaf fog.
Sure
I don't
does.
know if you've ever heard of it, but it's horrible. And
Isn't Lemoore Naval Air Station down there?
it's pretty close to it.
It's
Yes,
pretty close.
we were on Central Valley Highway, as a matter of
Yep.
fact, the one that led straight to it. And
Yep.
I remember laying on the hood upside down and intubating the man while he's still pinned,
Oh my God.
which was a feat within itself. Um, the fire department, after I was able to intubate him, I remember laying on the hood, giving chest compressions, and the fire department cutting the top of the truck off in order to get him out. But by the time all this was said and done, our new unit had came, and we were able to take him out. He ended up leaving on the helicopter, and then I ended up getting another passenger that didn't have as severe injury. Well, was not coding. We handed him off to the helicopter, and that EMT was not in the field very long after that. The stress, the PTSD, getting into a scene like that. Not only are you pulling up on a scene, but I could imagine the thought processes that he was going through, that he almost caused a tremendous, a bigger scene. So yeah, he wasn't in the field very long. I did end up running into him later on in life as I was working in the Department of Corrections. He ended up being a peace officer later on down the road in the Department of Corrections. But yeah, it was a horrific scene that time.
Wow, it's crazy. It's amazing, like what a human can do to save another human. Because I just keep doing the chest compressions and how tired arms are. I'm sure, you know. Me, I can't even walk up a flight of stairs without getting winded.
It is grueling. It really is.
Yeah.
Being able to perform, and a lot of the times you're running on adrenaline. You're not really functioning on muscle. It's all adrenaline, and it's all training to where you're functioning automatically. Usually after scenes like that, it takes a day or two to be able to take your adrenaline levels down. willing that there is no calls waiting for you back to back or anything like that, of course.
Yeah.
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 You know, we've all had close calls, but in his case, when you think about close calls and what it could have led to, I can understand him just being like jelly need at that point and not being able to function. And were you able to talk to him later when you met him about, I mean, how did you talk to him at all about how he could moved on or?
We did not. It was not something we talked about. Back then, it again the stigma of being weak or anything like that, and I like as I said, I did run into him later on, but in the capacity where he was working, um, even then as a peace officer at that time, you don't bring up any weakness. You don't talk
Yeah.
about situations where anything like that. And this is, of course, this is way back in the 90s, 80, 88 and 90s and early
Mhm.
90s. So it was a different era back then. Um, it was good to see him working. It was good to see him in a new capacity, um, somewhere where he didn't have to drive. Not to be cruel or anything, but yeah,
Yeah.
Yeah.
I can't say that I wasn't one of the ones that laid into him as well. There's a lot of fear and words that
Adrenaline.
come out when
Sure.
you're terrified.
Yeah.
Hmm. Yeah.
Well, I've watched, I'm a YouTube junkie, so I'm on YouTube all the time, and I'm watching different shows. And I watch, a lot of body cam videos of,
Oh yeah.
like after active shooter situations and stuff like
Oh,
that. And they're the police officers, the LEOs, they're yelling at each other and sometimes not kindly because they don't want them to get hurt.
yeah,
They don't want them to get shot. It's like, what are you doing? Move over here because they'll have maybe somebody young. And you can see that their adrenaline is all pumped up and they haven't been in a scenario like this yet. I mean, you've gone through training, but it's not the same until your butt's
it
really
is
on the line.
absolutely not the
Yeah.
same. There are situations where you get into where you have to rely on your training, and not everybody can blank out of a situation, still remain cognizant and paying attention to your surroundings
Mhm,
to make sure that you're okay, and then still function.
mhm.
I, of course, looking back on it now and even shortly thereafter, um, it was a total accident. He got caught up in we got to get to the scene. You could see the accident ahead. You could see the lights. The sirens are going. Your heart is just pumping 100 miles an hour. He was new. He got tunnel vision. He wasn't able to see the CHP trying to stop him and the chopper lights coming down. It's
Yep.
unfortunately it is something that some of us are can do, and some of us need repetitive um, training to do it. And it's such a dangerous um, profession to have to be trained on the job to learn how to
Yeah.
function
Yeah.
in extremely stressful environments. So this is where PTSD, this is where accidents come in, this is where tremendous scenes become major. So do I blame him? No, I really don't. Um, I thank God that nobody was hurt, that nobody died that day, that we all made it back home.
Right.
Yeah. It's
I
interesting that you talk about PTSD because we talked about it last week. And do you find that people, unfortunately, who are in those situations, that they think about what they could have and would have done like a few weeks down the road, and then they get harder on themselves because they're like, I failed that person. Do you see that? a lot in your work?
It doesn't happen a few weeks down the road. It happens from that point forward.
Right.
And depending on the individual, depending on the therapy, depending on one's ability to process and, lack of better terms, buy into the therapy and believe it, that there was no other choices, that you still don't question your training and your actions, that it stops there.
Yeah.
Um, Even with therapy, even with, therapeutic therapies that you go through, there's always some question in the back of your mind: should I have done this and should I have done that? And up to this date today, there are some questions where I look back and I'm like, I could have pushed this medication before this one. And even though I was on protocol, um, during that scene, there are still other protocols that are running side to side, so you can jump back and forth.
Mm-hmm.
Um, at least it was back when I was a paramedic. Allow going through protocols, giving medications. There was a lot of leeway that allowed us to treat our trauma patients and our cardiac patients, through different protocols. So
Yeah.
again, the looking back and I coulda, shoulda, woulda's, um, they are there. They are there, and it isn't until you process and you totally accept everything that has gone in the past, and there's nothing that we can do about it now, and we must live with all the decisions that we have made, um, whether they be life saving or we lose the patient,
Mm-hmm.
um, or the patient gets lost, and those are things that we live with. Um,
Yeah.
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 I wanted to ask you something, David. My friend's son reached out to me, couple of within the last week, and he's 16 years old, and he's a volunteer fireman back in
Wow.
Pennsylvania. Yeah,
Oh wow,
and
that's
EMS.
amazing.
He's learning, he's going through all of the training now. At 16, it's part of this is what he wants to do. Like, this is it. He just recently lost his mom very unexpectedly. He was the one who took over the scene at 16 and rode with her to the hospital, notified the family, got someone there to be with the sister. This young man is really remarkable. But I worry about the amount of trauma he's seen at such a young age. And how would I gently give him maybe the advice to seek somebody out at this point rather than wait till it's a lot of trauma response later?
Mm-hmm.
In my professional opinion would be to have him have a mentor, that you pick for him, somebody who's been in those shoes, somebody who's gone through that can mentor him and let him know that the longevity of his career is going to be dependent on his ability to process all the trauma that he's going through now, um, so that he can be made aware of the expectations and what he needs to do. I would be
Okay.
more than happy to talk to him and give him whatever advice he would need as a mentor, as a friend, as another first responder. Um,
Yeah.
and that would be my professional opinion on what would be best for young professionals getting into this field, because it's not a matter of if he's going to experience trauma, it's a matter of when and how much and how he
Yeah.
processes it.
Yeah.
Yeah. That's crazy
Yeah,
to
I
me.
get worried about that for sure.
Yeah,
Yeah.
Yeah.
I know at a young age there are a lot of unhealthy coping skills that we have. a lot of unhealthy coping skills. I remember choir practice that we called it
Yep.
after a traumatic scene where whether it be all the first responders getting together and buying a couple of cases of beer and you know
Yep.
howling the night away before we went home, or as peace officers, it happened as well. And
Yep.
we had choir practice, and
That's what
Lord
they called
forgive
it. That's what we called
Lord
it in the
Yeah.
forgive the
military.
term, but
That's what my mom called it when
Allegedly.
she was yeah, everything they confiscated from the teenagers that night went into choir practice that weekend. Yeah. Yeah, and okay, good. I will talk with him. He just reached out to me I out of the blue. And
that
I loved his
and
mother
that
dearly.
and that is him reaching out. That is him searching for something because it's affecting him already.
Um,
That is a flag.
yeah, I don't know that he's reached out for that. He knew that I've never met him, and his mother was a just a beautiful person, and rode and showed my horses for me when I was going
Ah,
through all of my back surgeries. And when she passed, I didn't even know she passed until I saw a notice on her
ah,
page.
Oh,
And then he said, "How did you know her?" He reached out, it's
oh,
been
okay, in that
a couple of
capacity.
months now.
Okay,
So, but I do want to be able to offer that to him when the time is right. I'll chat with him more. But for the young people coming into this field, and there's always young people coming into this field, like you said, the first time I think we chatted was look, get help in place now.
yeah, yeah,
Get
yeah.
somebody
definitely.
in place now.
Definitely look for a professional clinician, a therapist. That way, you are comfortable already. You're
Yeah.
not waiting until you're in trauma. You're not waiting until you're already affected and you grab somebody and you are hoping for a savior. Um, get somebody before that happens so that you're already aware of this person. They know your baseline behavior, they know what you are like before the trauma happens. And
Mhm.
that way, when you do experience trauma, and there are signs and symptoms of PTSD, your clinician therapist will be able to spot the difference and know that you are away from baseline behavior.
Yeah.
Yeah.
Yeah. It's interesting that you talk about that too. Um, as well as the first responder, we always want to look out for them. But how do you feel about the family members reaching out to get help with? Because believe it or not, we as family members deal with the PTSD alongside with our first responder. And
Most definitely. I mean, even in addiction, um, addiction that affects the actual addict not only affects the addict, but it affects all the loved ones. And it's the same thing
yeah,
with trauma. I mean, it's not just the person who's suffering PTSD, it is the family as well that lives with them and that has to witness this trauma and that has to witness their loved ones change and go through this pain.
yeah,
Definitely, if the family or when the family is affected by PTSD, to reach out and get help. Definitely.
yeah. I think that's really important as well.
I agree. I agree 100%. Um, yeah.
Yeah. So David, you had sent me some information to read, and I did read it. Some of the papers, the clinical papers, how it on this, it's called ART, I think.
Accelerated resolution therapy.
Right.
Um, there are different types of therapeutic interventions used for PTSD and trauma. The art therapy is one of them, and if you don't mind, I wouldn't mind getting into that one last.
Sure.
But there is the trauma focused cognitive behavioral therapy, and that one um, can be provided through a clinician that is licensed. Cognitive behavioral therapy can be provided by a paraprofessional as well. Um, But these therapeutic interventions are aimed to help the person process the traumatic memories, the emotions related to them, and that's the
Mhm.
important part. And to be able to achieve their understanding of the trauma and clarity through it. Um, they help the individual cope with, and I'm reading, so please forgive me here. They help the individual cope with controlling their response, their emotional responses. A lot of the times when we go through PTSD episodes, um, our emotions are all over the place.
Yeah.
If we don't automatically shut down, we are somewhere else. So I can, yeah, I can personally say that it is a process where through through these interventions we gather some emotional intelligence, so where we're able to identify these emotions, name them, list them, and to be able to process them. Um, Extremely important. Um, they allow you to reach a healthier mental and emotional state during the episodes. Um, and then they encourage you to develop and achieve your recovery goals, not just recovery through substance use disorder, but recovery through your PTSD or your trauma.
Mhm.
um, there are you and I use them co-occurring because a lot of the times our PTSD actually will cause a person to go through substance use, whether it be alcohol or drugs, to self-medicate, to help forget about or to help process these traumatic emotions that we're going through. Um, yeah, and some of the definitions that words that I just said, like self-medicating, for people who may not know, it is people who use substances or alcohol to numb the pain or the anxiety or even the distressing symptoms, or the flashbacks or the nightmares.
Yeah.
Self-medicating is basically us who had suffered PTSD using substances instead of medication and therapy to help alleviate these symptoms and push them down. Unfortunately, this is our road to addiction. This is where the co occurring behaviors happen. This is why it's so prevalent. Uh, Substance abuse is so prevalent with this trauma that's happened to people, and it's not just PTSD from first responders or military. I have some statistics here um, on our PTSD, where it is a 6 to 8% of the adult population experience PTSD at some point in their lifetimes. Um, Women are twice as likely to develop PTSD, uh, 8 versus 4% of the population.
That's
8% of
great.
women, twice as much as men.
Is that from is that from, like, sexual trauma abuse?
This is all trauma. This is
All
just
trauma.
PTSD in general.
Yeah.
Um,
Okay,
yeah, it didn't get specific. It's
okay,
related to PTSD, or I'm sorry, not PTSD. No, yes, PTSD, not
great,
specifically first responder or military. It is just
okay.
PTSD in general. Veterans, of course, PTSD is more common among veterans, with a lifetime prevalence of 13% of all veterans will have some form of PTSD. Racial and ethnic minorities. Studies have shown mixed results on PTSD amongst racial and ethnic minorities, depending on their backgrounds and whatnot. Um, Down to sexual assault, you had said 31% of women and 11% of all men who experience sexual assault develop PTSD.
Wow,
That's great.
Witnessing violent deaths, and this is your first responders, this is our military. 15 to 20% of people who've witnessed violent death develop PTSD. Um, I'd like to, I kind of think it would be more. Um,
you would think.
I would
Yeah.
think it would be more.
Mm.
This is, I guess, who admitted to it.
Yeah.
Yeah.
Combat exposure, we're looking at 20% of veterans. Um, and then childhood abuse is another 15 to 20% of all people who went through childhood abuse develop PTSD. So um, if there are any signs of PTSD in whichever, it not necessarily has to be first responders or military, find your clinician, find your therapy, find your help.
Yeah.
Mhm.
I know that we went through the signs and symptoms of PTSD. I mean, there's no definitive signs like hard, concrete, symptoms because everybody's different. But can you go through those for our watchers and listeners, like who are like wondering, well, I wonder if my husband or my brother is going through this.
Of course.
And David, would you mind speaking up just a little bit?
Okay, is my
Eh, Yeah, it's just a little low. Thank you.
okay. The some of the signs and symptoms are intrusive memories, nightmares, reliving the traumatic experiences, avoidance of people, places, activities that remind them of
Shopping.
their trauma, avoiding thinking about events. In my case, a lot of it is totally blacking out events to where
I,
most of my military career has been completely blacked out. Um, I mean, I know I was there from pictures, but it's
yeah, man, it's like
it's
you just checked every box that I have.
Hmm.
Yeah.
right, and there are feeling detached from others, emotional numbness, um, persistent feelings of fear, anxiety, guilt. Guilt is a big one. The should I have, or would I have, or could I have?
Yeah.
Um, Difficulty concentrating, making decisions, changes in beliefs about oneself, how you look at yourself, hyperarousal and reactivity, feeling constantly on the edge or on guard, hypervigilance, an exaggeration, startle response, irritability, anger outbursts, sleep disturbances. There are a lot of different ones. There can be chest pain, stomach problems, of course, headaches. Um, One of the big ones is substance use and changes in appetite. And of course, the worst symptom is suicidal attempts and suicidal ideation and thoughts.
Yeah. Yeah.
Gosh, I mean, and not everybody's going to have the same ones, right? So
No,
it's
absolutely
in
not.
clusters of different things.
Yes,
Yeah. Sorry,
and
Jesse.
it's not
That's a
always the same one. They can bounce back and forth depending on the situation, depending on the trauma you may have experienced. I myself was extremely fortunate to have gone through first responder, through peace officer, through military. So I've got a grab bag of PTSD that I could choose from, and the symptoms and the symptomology to go with it.
yeah.
It is different for everyone.
Yeah. And it's interesting because my Leo sometimes he'll cancel something at the last minute because he does not physically or mentally have the energy to be around family or even friends that are considered family. And it's not that he's doing it to be facetious or mean. He's doing it because he mentally cannot handle getting off a shift and then have to go and people again.
Yeah,
And that's, and then again, that's where the family suffers because they don't understand why daddy doesn't want to go to a birthday party because he doesn't
Yeah.
want to do it. He just can't mentally do it.
yeah.
And
So,
I'm
Making
there,
yourself
Jesse.
detached from others in order to
I
to be comfortable.
yeah.
absolutely. I really have to force myself to go out. I really do. I really don't like going out. And
Hmm.
it's hard. It's maybe that's just my innate distrust of people at this point, but it's hard that like and we do things as we're involved with our other groups and stuff, and we teach courses at ISU, and that's how we met David.
Yep.
But that it's a leap of faith for me to go out the door and do something like that because I'm like, okay, this is I got to do this. I got to do this. It's hard. I
And
enjoy those friendships that we've made and that kind of stuff, but it's still hard for me. Yeah.
yeah, yeah, and one who has gone through trauma and has their PTSD and their issues, we normally and can occasionally spot others with the same that has experienced trauma and that have gone through it. And that is one of the first things that I have noticed. Uh, SOS that out of everybody that I've met, I've know I we tend to spot each other.
Hmm.
Yeah. Yeah,
It's true.
it's hard and you don't yeah, it's tough. So I'm these conversations are very, very important. And David, you've started the Active Community Solutions. That's your company. And you're expanding that, and I think that's brilliant, because
Me too.
we need more therapy out here.
Yes,
And
I
now
agree.
and yeah, and um, we need to lose the stigma, and we preach this every single time we do an episode,
Hmm.
is to lose the stigma attached with raising your hand and say, "I need help."
Yeah.
Um,
I agree, and I think we need to even take the word stigma out of it. We need to make it a natural process to where if somebody is going to be employed in a very traumatic employment or a first responder employment, that somebody who's going to go into the military, it should be hand in hand to where they are already in the process of finding a therapist or finding somebody that they can talk to, a mentor who can provide therapy or counseling or whatever the case may be. I
sure.
mean, it should be hand in hand, and it shouldn't be a stigma. It really shouldn't. It should be a prerequisite.
Right.
Um, do you have your CPR card? Do you have your range card? When was the last time you seen your therapist, and when is your next appointment?
Yeah. Yeah. I
Yeah.
agree.
Now, before we have about 10 minutes, we can wrap up here. Where you we there was that art therapy, and this was not quite what I went through. Um, it's different, but it was really interesting because what I thought was really interesting when I read some of the papers on this therapy was that they were getting results sometimes in the first session.
Yes, yes.
And
Accelerated resolution therapy. Um, Here in Idaho, you have to be certified. You have to be a licensed clinician, whether it be a licensed counselor or a marriage and family therapist. Um, you have to have a master's degree in counseling or therapy. Um, Art therapy is an eye movement therapy that provides consistent and reliable relief. And again, I'm reading. Um, Treating anxiety, phobias, addiction, PTSD, and trauma. Average, it takes 3 sessions, and you can even see results in your first session. And I seen results in the first session on some of my clients because in substance use disorder treatment, I have found it to be just so much more effective when it is a co-occurring treatment where they are getting art therapy as they're getting substance use disorder treatment. I see the results so much clearer, so much faster, to where we have less relapses and we have less people going back out. But let me continue before I get off on a tangent again. Art therapy was discovered in 2008 by Laney Rosenwig. He was a licensed marriage and family therapist. He first started using ART techniques successfully to treat clients with obsessive compulsive disorders during the 1 hour sessions. And then since then, the procedure has been refined to help individuals with PTSD, substance use disorder, physical sexual abuse, depression, eating disorders, fibromyalgia, and chronic pain and other phobias that people have. Art has been clinically demonstrated to resolve PTSD symptoms in 3 sessions, not 3 sessions, 3 sessions. So,
That's
I mean,
absolutely
and from
crazy.
what I've
That's
seen it work. I mean, um, it is an amazing therapy that it's also a evidence based practice. And SAMHSA has recognized it. The federal government. It's the mental health services for the federal government. SAMHSA has recognized it as evidence based practices. So again, I myself, whenever I have a clinician, in the last employment where I had a clinician who was trained in art therapy, and we would run hand in hand. As it is right now, I am looking for a clinician. So if there's anyone out there who is trained in art therapy, please contact me, and hopefully we can get together and provide services to the community and Idaho in general. We have been
yeah,
providing, so it has been known to work even through telehealth services, to where you don't have to be sitting front face to face. So
That's
yeah,
so in a real briefly. Now, if I got what I was reading today, because I was focusing on how it was helping the military, but it's replacing the images of trauma with a pleasant image,
it is not replacing the images, it is replacing the emotions,
the
the negative
emotion.
emotions that come with the images that one has.
Okay.
Whenever we have our images of PTSD and those negative emotions, whether it be a smell, whether it be a sight, once we gather that smell, and I'm going out of my own personal experience with my own PTSD, there are some times where I'll hit a smell, and all of a sudden I'm taken back, and fear automatically overwhelms my entire body, my mind, and it just shuts everything down. The art therapy takes the emotions out of the equation and puts happy emotions, or the emotions that the client chooses to put into them
That's
instead.
that's really something.
Yeah,
yeah,
it,
Because
it is it is
yeah,
amazing. Cognitive behavioral therapy, training your brain to do something better.
yeah,
It's
that's incredible, and I hope more people look into it.
yeah.
yeah.
Me too. I think it would be. It's great. Like it's better than what they have been receiving in the past.
Yeah,
There's what I find is a lot better is there's no medications that need to be done in order to get art therapy. It can be done in a couple of in the first sessions. You're going to be getting results. Up
that's
to three
that's
sessions, you can
huge.
have it down.
Yeah,
You bring up, David, you bring up medications, and I'm the first one who won't take something.
Yeah,
I won't do it
yeah,
because the VA was constantly throwing pills at me of every variety, and I'm like, I'm not. It, no, I'm just done. I'm done with pills. I'm going to try to figure this out on my own, and I had to. I've had to.
yeah.
It
It's
doesn't.
like
I
It's
masking
not
a
always
situation.
successful.
yeah.
Yeah, but
As a counselor, I there are times and places where medications are needed. Um, and there are certain situations where that therapeutically they will do a lot better on medication. Do I believe that is in every case? Absolutely not. I myself have been put on tremendous amounts of medications in the past, and this day right now, I am not on any mental health medications, and not because I don't have symptoms, and not because my PTSD is cured or anything like that. It is because of the therapeutic interventions that I went through that allowed me to be able to process the traumas, to be able to function in my own mind without them. And
Okay.
that is the target. That is the goal right there.
Yeah.
Um,
Yeah.
do I still suffer from episodes? Yes, I do. Um, but are they as traumatic? And do they take over my life like they used to? No, they don't. It is a matter of learning how to process them and
Yeah.
to live through them and live
It's
with
almost
them
like
because
take the
they are
bull by
part of
its
the show.
horns, basically,
Yeah,
like,
they are part of us
face
now.
it. Yeah.
Hmm. Wow, this was just a great discussion, and I know that we've asked you to come on more regularly to share some of this stuff because knowing you, you're not just a face out there that we don't know. We know you, and we know that
Yeah.
you are in it to help, and you're going to be providing techniques and all of this information to the people watching this show, and it's a win-win. It's
Yeah.
Yeah.
people making connections with you and your business, but more it's to everybody who watches the show on YouTube because we're going to reach people all across the world who will tune in. There are
And
therapies and treatments out there, and something will
right
gel with
now, if
you.
there is anybody out there who is suffering um, through any of the symptoms that we have talked about, PTSD or trauma, past trauma, please feel free to contact me. If I cannot provide the services myself, I will be more than happy to find you a referral in your area um, to make sure that you get the help you need. And again, as of right now, we are located in Idaho only, and I say as of right now.
Right.
That doesn't mean that Active Community Solutions will remain in Idaho. Whether we stay here and branch out to different states, that will be um, in Heavenly Father's will.
Yeah.
Yes,
I think
thank
it's
you.
just an amazing service that you offer. Thank you so much.
Thank you.
Absolutely. And we will put
It
David's
has been
contact
my pleasure.
information. Oh, sorry, David.
Oh, I'm sorry. I mean, it has been my pleasure. It is my life. It is my life goal. I myself come from trauma and addiction and whatnot, and I have suffered a lot of different traumas to where I had made a vow that this is my business and this is my mission.
Wow. It is a blessing to know you, and
Yes.
I only want to help further your business as well because your business is in the business of help, and that's what people need. So we're going to put all of David's contact information in the description of the show. So click down, and you're going to see it. We also always in all of our shows put suicide hotline information because please reach out if you're feeling like that. Make that call, and don't let it be today. Take one more sunrise and work
Amen.
it out because we've all had a battle through that at one time or another, or we wouldn't be sitting here talking. So, um, thank you so much, and we look forward to talking to you next time, David.
Sounds good. Thank you very much. God bless.
Thank you, David.